Hello everyone, this is Dr. Neha Vatyani. Today, the condition of our world, our nation, is getting worse day by day to this deadly coronavirus. In this video, I'm going to tell you something very useful information, that is scientific correlation of action of coronavirus on body and our mindset, which will help doctors to treat the disease and common people to prevent themselves, their family and friends. This research has been conducted by Dr. Kishore Narar, a homeopathic doctor from Nagpur, India. How coronavirus enters into the human body. As research has already shown that coronavirus enters into the human being through angiotensin converting enzyme 2, that is ACE2 receptor of nose and mouth, which then settles into the lungs, where these receptors are found in abundance. In this image, we can see where the ACE2 receptors are present in our body, that is nose, tongue, heart, lungs, colon. Coronavirus then latches to the ACE2 receptors, making it a lock and key phenomena. By blocking ACE2 receptors, there is increase of angiotensin 2 in blood, which causes increased blood pressure and inflammatory response like fever. Further study is done by Dr. Kishore Narar, in which he says increased angiotensin 2 stimulates sympathetic nervous system, which is the part of autonomic nervous system. Autonomic nervous system, that is ANS, comprises of SNS and PNS. We can see in the image what SNS and PNS do. PNS helps in digestion and gives rest to body and mind. SNS gets activated when our body and mind are active and alert. It means if we see any danger or threat, SNS gets activated and hence our heart beats faster. We start sweating all over. Our eyes becomes more active, becomes widened, which we called as dilatation of pupils. Along with that, SNS releases epinephrine in the blood, which is actually a stress hormone. This is called as flight and fight response. Let us see how fight and flight response works. Let us consider coronavirus is a danger or threat. Then what will be the response from different people? Let us see some example. If the person chooses to fight, then his epinephrine or stress will not be increased. He'll succeed to overcome the disease of coronavirus. If the person chooses to flight, that means to run away. In that situation, he gets panic. His heartbeat increases and epinephrine also increases in the blood. In this condition, there will be two situations. Either he'll fail or die due to heart attack. Fail here means might he get moderate to severe symptoms. It all depends on the perception. Now, let us understand what is perception. Perception is how we look at a particular object. Example, if we see a dog is sitting and three people saw it, first person see him as a dog and ignore. Second person is affectionate for dogs, so he'll feel love for him. The third person, who is coward person, gets frightened and assume it as a big danger, like a lion. He feels as if he'll get injured or may die. That person has allowed his SNS to get activated, and eventually his brain secretes more and more epinephrine into the blood. Now, what does more of secretion of epinephrine or adrenaline do? Increased angiotensin 2 stimulates secretion of epinephrine, which increases inflammatory response from cells and causes cytokine storm, due to which there will be raised interleukin 6 levels and CRP. To understand how exactly cytokine storm occurs, let us see one example. Let us consider there is a war between our body and coronavirus. When coronavirus attacks our body soldiers, that is cytokines, fight in the normal phenomena, which is a fight response. But if our body perceives it as a big threat or danger, then our mind secretes more and more epinephrine, which in turn fuels up the cytokine to fight, resulting into accumulating so many soldiers to fight. This will cause the cytokine storm, which is actually for fighting purpose but lands up damaging our own body tissues, the that is lung tissues. The disease then progresses, resulting into the increased ferritin levels and lactate dehydrogenase. If the disease further progresses, it forms the blood clots in the capillaries, and this is the reason of findings of ground glass opacities in HRCTs and increased D dimer levels. From this stage, resolution usually starts in many people. That is why the death rate is less in people, even though there is a moderate damage to lungs. But in some people, if there is sudden increase of panic, like in hospitals, if one patient is recovering but sees another patient next to his bed died due to same reason, then panic increases in that person as well. This is the stage when stimulation of granulocyte macrophage colony stimulating factor starts, whose main action is to help in healing and repair. But along with that, it also stimulates formation of superoxides by activating reactive oxygen species, which further damages the alveolar lung cells and causes myocardial infarction, that is heart attack. So we should not panic. At last, the conclusion is the effects of coronavirus vary from person to person, with the symptoms from asymptomatic to death. It completely depends on how we respond to the attack of virus. The spectrum is broad. More the panic, more will be the release of epinephrine and greater will be the loss. Question also arises why coronavirus is affecting everyone, even children who are unaware of understanding panic or danger. So here is the answer. Coronavirus can affect anybody, but how you tackle the situation is dependent on you. While the children who are innocent, unaware of danger can be affected by coronavirus, but many remains asymptomatic or may have mild symptoms, because here coronavirus don't get its favorable condition to replicate and it goes off. Question also arises that in the third wave of coronavirus, why children will be affected more? The answer to this is coronavirus has already created so much of panic situation throughout the world. Children also know the name corona. They frequently hear this word from their parents or family members. The protector means the parents get so much frightened hearing the word that they takes care as much as possible for their kids. Kids' mind learns all these and starts frightening too in a manifold way. Hence, in this wave, the symptoms may also be seen in children. So please don't create panic. I hope everyone who's watching this video will also understand what we need to do to prevent ourselves from this virus. Thanks for watching our video. Stay safe, keep distance, don't get panic.